Good morning. It's my pleasure to be here with you this morning. We're at a unique time in our nation's history where the vast aging of population is coinciding with advances in biomedical research, in health, in technology, that is really changing the way we're aging. And this convergence of trends in the way we age with the advances being made in health and in well-being is creating an unprecedented opportunity for us to disrupt aging, particularly in the area of health. This morning, I want to have a discussion with you about the big shifts that we see that are occurring in this aging space. I want to propose for you a new vision for health that puts well-being at the center of that discussion. I want to talk about the 4 shifts that needs to occur within the healthcare space. And lastly, to talk about the huge market opportunity this aging and longevity presents for people in this business sector. Disrupt Aging is about challenging the outdated beliefs about aging. The way we are aging is changing, and yet the stories that we're telling ourselves and the products that are coming to the market aren't really keeping pace with the way we are aging. Disrupt Aging is about changing the conversation in this country about what it means to grow older, that it's not so much about the aging part, it's more about how we focus on living and living our best life every day. Think about this. In the next 2 days, 20,000 people in the U.S. will turn 65. Over at the TD Stadium, that means that stadium would be filled every 2 days for at least the next 14 years with people over the age of 65. The 65-plus population in the year 1930 represented roughly 5% of our population. Today, it's 15%, and by 2060, it will be 24% of the U.S. population. 2/3 of all people in the U.S. who have ever lived to be 65 are still alive today. Not only are they doing great things in their lives well past the age of 65, but they're also living healthier. Think about Japan. We see Japan as an old country. But by 2050, 31 other countries in the world, including China, will be older than Japan is today. And these folks aren't just living longer, they're living healthier. Think about a 10-year-old you know. Could be your own child, niece, nephew, grandchild. That 10-year-old has a 50% chance of living to be 104 years old. And that's not in the future, that's today. People are living longer and healthier, doing more things in their 50-plus lifespan. Quite simply, the way we are aging is changing. The old notion that people would peak at middle age, retire, to go home and decline just isn't happening. People are going back to school, they're dating, they're getting remarried, they're changing careers, and in fact, 80% of boomers tell us they plan to work past the age of 65, either full-time or part-time, either because they have to or because they want to. And this is generating an additional income or spending authority with the 50-plus cohort. In fact, $7.6 trillion annually is created in economic activity by those over the age of 50. That means more spending power, more money to do and make choices and buy products and services, particularly in the area of healthcare. For every dollar spent in the U.S., 51 cents is spent by someone over the age of 50. We're staying healthier longer. We're taking care and more care of the people around us. We're working, we're planning, we're building our lives for the future. Do you realize that you're probably going to spend more time caring for an elderly parent or loved one than you actually spent raising your own children? Quite simply, the way we think about health is changing. The consolidation in the healthcare industry, Deloitte's research tells us that in the next decade, only 50% of the companies currently working in the healthcare space will still be there. People are moving from a fee-for-service to a fee-for-value mode. Healthcare is actually happening in the home. 90% of the people tell us that they want to age and live in their own home. And technology is changing everything we do, from telemedicine to social media. All of this is really transforming the way we are living our lives today. And it's time for us to disrupt the way that we think about aging and this area of health. We've come to realize that the choices we make each and every day in our lives have more to do with our health outcomes than the occasional visit to the doctor's office. In fact, 60% of the choices that we make every day decide what our healthcare outcomes will be. 20% based on the medical care we receive, and another 20% based on our own DNA or genetics. Dr. ATUL GAWANDE said it best. He said, "We have medicalized aging, and that experiment is failing us." And I think that's true. We have to create a whole new vision of health that puts well-being at the center of our lives. I often talk about, in order to do this, we have to follow through on what I refer to as the 3 Ps. That we have a personal responsibility to take care of ourselves, to feel and exercise and eat healthy at an earlier age for longer periods of times. That in the public sector, that we have a responsibility to build out livable communities that allow us to live and age in our communities and work and get access to health care and transportation in the communities in which we live. And indeed, the private sector has a responsibility to meet our needs where we are, not where they've built them. For us the private sector, to come up with new solutions and products and services that allow the 50-plus to live the way they want to live. In order to do this, we need to focus on what I refer to as the 4 major shifts. The first one, from physical and mental diminishment to physical and mental health. And this is really about not treating the symptoms, but treating the whole person, putting mental fitness at the forefront of our conversations. I'll give you 2 examples, one on the positive side and one on the negative side. We know that people who have purpose and meaning in their lives are less likely to have strokes and heart attacks. They have fewer visits to the hospitals, and indeed, they have less use to have to go to doctors on a regular basis. On the other side, if in fact you're lonely or isolated, it's the equivalent of smoking 15 cigarettes a day, shaving nearly 8 years off of your lifespan. And as I discussed earlier, the fact that we're living longer and that the majority of those folks who are living longer are women, we can understand the implications of this loneliness and isolation issue that we all need to take serious and address in a more forceful way. The second shift is a primary focus on treatment to a focus on prevention and well-being. It actually puts the whole person at the center of the conversation around prevention so that we don't get sick in the first place. What are those actions that we need to take in our own lives that allow us to take control of what our health outcomes will be? The third is the move from being dependent patients to empowered users of the healthcare system. How do we as patients understand and use the information available to us so that we can ask the right questions, so that we can take control of our own lives, rather than being dependent on a collaboration from nurses, doctors, hospital, care advocates, and a whole host of family and friends who often get involved in our own healthcare. And the fourth shift is from uncertain access to care to dependable access to care, focusing primarily on the hospitalization. How do we, as individuals and as society, put this dependable access to care that goes beyond the hospitalization system and healthcare system to looking at wellness collectively across the lifespan? These are important issues and shifts that we need to make in the way we deliver health care across this country. At AARP, we certainly know that there are over 100 million people today currently over the age of 50 in the US, and that they are looking for opportunities to engage with all of you around new products and services. In the area of health, we've identified these 9 areas where we think there is in most need of innovation and transformation in the way products or services are delivered to our 50-plus consumers. I won't go through all 9, but I will hit on just a few. Medication management. So important to have products and services, whether it's apps or identifiers that can track medication being consumed, what time we're taking it, what's the effect that it's going on. How can we come up with new solutions that allow people to manage the many multiple drugs that they're having to take on a daily basis? How do we focus on safe living? How do we build out and reconfigure homes that allow people to live in them safely as they age? How do we make sure that those homes have access to the front door, that it's as easy for a mother with a stroller to get in the front door as it is someone over the age of 60 or 70 who might need some kind of walking assistance? In fact, how do we get the housing industry to start designing houses that allow people to live in their house for a lifetime rather than assuming that they have to move out of their own homes and into some other kind of facility in the latter parts of life? How do we use social media and social engagement to allow us to live our lives better, to address those issues of isolation and loneliness, to have connections so that they can be involved in their communities through social media and advocacy? How do we use social media to drive change in our own lives at the local level as well as the national level? One area where I do think we have made the most advancements is around diet and nutrition. And this whole idea of home delivery of foods to meet certain needs, whether you're diabetic or you need lower cholesterol meals. The advances that we've seen and the new companies that are popping up all across this country that provide just-in-time meal service is really advancing the quality of health and nutrition all over this country. And lastly, the one that I deal with every day, the physical fitness. How do we get people who know that it's important to exercise every day? How do you make that 20 or 30 minutes of your day time available to be able to be physically active and be physically fit throughout your lifetime, not just when you fall upon an ailment? For the companies who want to engage in these areas, there's a wealth of opportunities for the 50-plus consumer. In fact, we believe that for companies engaged in this marketplace, that people in the 50-plus age cohort, there is an ability to adopt over 100 million people towards your product by the year 2020. At the center of all of this change is this idea of innovation and technology. Technology is the driving force behind a number of these initiatives that we've talked about. And the misperception that people 50 plus don't use technology just isn't true. In fact, we know that boomers spend more time using some kind of technology, perhaps not as fast, than millennials all across this country. And so for those who want to engage with us, you have to create products, particularly in the area of technology, that allow people to be able to use those products on a daily basis. I often talk at AARP with our staff and volunteers about we need to be the change that we want to see in other companies and in society as a whole. And I'm pleased to say that we are moving very intently in that direction. Just last year, AARP launched the AARP Innovation Fund, where we work with our partners at JP Morgan Chase Equity to manage this process for us. But we've agreed to invest over $40 million in startup organizations who are intently focused on driving products and services in the healthcare space around healthcare access, around prevention, and also about living in place. And so we have actually provided funding to at least 2 startup companies in the last 12 months in this area. We've also been engaged around healthcare transformation with United Health Group, really trying to put the consumer at the center of the transformation that's going on in the healthcare space. And we are seeing enormous good research coming out of that collaboration. Some of you may have heard about our AARP Health Innovation at 50+ events. We've been doing this with Jody Holtzman, who's going to be here with us later today, twice a year for at least the last 5 years. We've had over 828 new startups come to our innovation events to present their products and services. And of the 45 companies who have made it to the finalists, 23 of them have raised over $145 million from venture capitalists and investors, and indeed 4 of them have actually already been bought out. So a lot of great things happening in this particular space with startups moving in this area. We're working with a project called Project Catalyst, where we're bringing together United Health Group, Pfizer, Robert Wood Johnson, and AARP to put the consumer, our 50+ members, at the center of innovations, so that if you're thinking about creating a product or services, we have in fact enlisted over 1,000 AARP members who are willing to engage with that product and tell you how it's working or how it's not working so that it can meet the needs of the 50+ consumer. And that's really some exciting research that we're doing. I know we're starting with the activity trackers and some of the other devices, but very exciting work in that area. And for many years, we've been engaged with the Robert Wood Johnson to be the focal point for the Center to Champion Nursing in America, something that we're very proud of how do we engage nurses all over this country and provide the training and training guidelines they need to be able to serve our populations better. And last but certainly not least, the Longevity Network, which I talked about earlier, which really provides the research and the foresight for where we're going in this 50+ population and the economic activity that is there for the taking for those who want to work in that space. So lastly, disrupt aging. How do we change the conversation in this country about what it means to be 50 and older? How do we create a society that really embraces this opportunity of aging as something to look forward to, not something to fear? To see this 50+ cohort and this time in their lives as an opportunity for growth, not decline, and for individuals and businesses and consumers to see this as an asset to society, not a burden. We think for the companies who are willing to engage with our 100 million+ folks in this 50+ area and growing every day, that there's a huge market opportunity for companies to get engaged and to disrupt aging, particularly in the healthcare space. We welcome your involvement, we welcome your ideas, and thank you for the conversation this morning.
Good. So I just want to acknowledge, I'm Alex Drain. I'm going to be the MC for the morning. I just want to acknowledge you used to quote, be the change you want to see in the world. And as an entrepreneur, as somebody who worries a lot, she talked about all of these seniors, this silver tsunami that's coming. Well, someone's got to care for those seniors, right? And it's not just the traditional clinical workforce, it's this room. It's us as sisters, as husbands, as wives, as daughters, as neighbors. And I don't know how many of you guys are really familiar with the whole caregiving space. I'm guessing a lot of you. There's more and more recognition that we have to think about caregiving almost like a disease, as something as hard on our health as diabetes or cardiovascular health. You also talked about inciting folks to get involved, creating market opportunities. And you guys have done more to put caregiving on the map, which enables a room full of entrepreneurs to be able to get money, raise money to go make these new technologies and platforms happen. And I just wanted to share two with this audience in case you guys aren't aware of them. One, they released, AARP under Joanne's guidance, released a report that quantified the upside in the opportunity for every $1 invested in caregiver solutions between a 1.7 and 4.45 ROI. So if you're trying to get an employer to get off their rump, to go invest dollars in supporting their employees who are caregivers, it's really hard to get them to do it unless you have big brands coming out with big reports that say, you'll make money on this. You should do it because it's the right thing to do, but you'll make money on this, which you guys did. Thank you.
Thank you. And I would say, too, that this year we made the decision to give our employees up to 2 weeks a year off to do caregiving for a loved one or a family member. And we have reaped the benefits already this year from the enthusiasm and the support and the appreciation from the staff. And we would encourage other companies to do that as well.
Amen to that.
Thank you.
And then one other quick one, which is you also did the CARE Act. And for those of you, this is incredibly important as well. They launched the CARE law that mandates that you record the name of the family caregiver at the time of hospital admission, provide family caregivers with adequate notice prior to hospital discharge, and simple instruction of medical tasks that you'll be performing when they return home. And that's now legal in 21 states.
It is, and that change through state legislatures across this country is positively affecting almost 30 million families. Yeah. And so we're very proud of that, and thank you for recognizing it.
Yes, thank you.
Thank you all very much.
All right.